Welcome to the Deep Dive. Today we're tackling a really significant topic for dog lovers, and especially for breeders, canine herpesvirus, or CHV. We've got some great info here from canine herpesvirus infection, basics in diagnosis, and our mission really is to understand this virus better.
Yeah, break it down.
What it is, who it hits hardest, and, how we can spot it.
Exactly. And CHV, it's one of those, well, hidden threats, isn't it? Adult dogs often carry it without showing any signs at all.
Right.
But the impact, particularly on tiny puppies and pregnant dogs, it can be just devastating.
Okay.
So we'll look at the essentials, what it is, the signs, how vets figure it out. And I think a key thing to grasp is that your adult dog might seem perfectly fine, but could be silently carrying it. And that poses a risk, especially to vulnerable newborns. That's really crucial if you have multiple dogs or you're involved in breeding.
Okay, let's unpack this then. The article starts off saying CHV causes a systemic infection, but only in immunologically naive animals. What does that mean exactly in the real world?
Right. Think of it like this. If a dog's immune system is sort of seeing this virus for the very first time, it hasn't built up any defense, then the virus can spread everywhere throughout their whole body. And the article really emphasizes how different this looks depending on the dog's age.
How so?
Well, for puppies, really young ones, say younger than 2 or 3 weeks, this systemic infection, it's usually fatal.
Fatal, wow.
Yeah, it's a stark reality. CHV is a major cause of death in those first few weeks, often strikes suddenly. It causes huge heartbreak and losses for breeders.
That's incredibly tough. And it's not just the newborns. The article also talks about serious consequences for pregnant dogs who haven't been exposed before.
That's right. If the mother is naive, hasn't met the virus, infection during pregnancy can lead to things like fetal death.
Oh, no.
Mummification, which is, as grim as it sounds, and abortion. It's a massive potential blow.
But there's a twist, isn't there? For pups born to mothers who have been exposed.
Yes, exactly. If the mother is immune, she has antibodies. Her puppies often get some protection initially. They might still get infected, but instead of a fatal systemic disease, they tend to develop a lifelong latent infection.
Latent infection. Okay, so like the virus goes dormant, it hides.
Precisely. It sets up shop, basically, in the neurons of sensory ganglia, tucks itself away in nerve cells.
Okay.
And the article explains it can then reactivate later, especially if the dog gets stressed or if their immune system is suppressed for some reason.
And when it wakes up, it starts shedding again through nasal fluids.
That's the idea. It can lead to nasal shedding, potentially infecting other dogs.
And does reactivation cause symptoms in the dog itself? The article mentioned mild respiratory signs or eye problems.
Correct. You might see a bit of sneezing, maybe a runny nose, but the bigger concern often with reactivation is ocular disease, eye issues.
Okay.
And this can range from just mild irritation like conjunctivitis to, well, quite severe problems.
And is that common?
Actually, yes. The article notes this latent infection is very common overall, and these eye problems in adult dogs from CHV reactivation. They happen frequently, but are often missed or misdiagnosed. We might just treat it as simple conjunctivitis and not realize CHV is the underlying trigger,
It's amazing how something so common can be so sneaky. The article also says mature, non-pregnant dogs can have these inapparent infections.
Localized.
Yes, localized in the upper respiratory tract, the nasopharynx, or even the external genitalia.
So, adult dogs, male or female, could be carrying and maybe shedding this virus without anyone knowing anything's wrong.
Exactly. These localized infections often show zero clinical signs in mature, healthy, non-pregnant animals. This silent carrier state is a big part of why the virus persists so widely in the dog population.
So who's really at the highest risk then? I mean, the article says all canines can get it, but the danger level seems very different.
It is. While any dog can get infected, the greatest risk of severe disease and death is definitely in those very young puppies. Typically, the article says between 9 and 14 days old. That's specific.
Yeah, though the range is really from birth, potentially even prenatal infection, up to about a month old. Neonatal period.
Okay. And it mentions higher reporting in purebreds, but not a breed thing.
Right, they clarify that. It's likely just reported more often in purebred circles, probably due to closer monitoring in breeding kennels, not because certain breeds are inherently more susceptible.
Got it. So what are the sort of red flags, the warning signs in these vulnerable pups? It sounds quite distressing.
It really is. The article lists several things to watch for. Difficulty breathing, that's dyspnea. A nasal discharge, which could be clear at first, then maybe thick, yellowish, pus-like. not wanting to nurse anorexia. A very specific kind of stool is mentioned grayish yellow or green, soft but notably odorless.
Odorless. That's interesting.
Yeah, and one of the most heartbreaking signs they describe is persistent, agonizing crying, just incessant crying.
Well, it sounds awful.
It is, plus potential neurological signs like tremors or seizures, and then severe gasping for air just before death. Sometimes you might even notice tiny pinpoint hemorrhages, petechia, on their gums or skin.
And it happens fast.
Incredibly fast. The article highlights a sudden onset, with death often occurring within just 12 to 36 hours.
Oh.
And tragically, sometimes puppies are just found dead, no warning signs observed at all.
That's devastating. And what about the ones that, against the odds, survive the initial illness?
Even for the few survivors, the outlook can be guarded. The article points out they might develop long-term problems, things like ataxia, which is poor coordination, vestibular signs affecting balance, or even blindness. It's truly a terrible disease for newborns.
Shifting focus a bit, what about mature female dogs? Are there signs an owner might see that could point towards CHV?
Well, it can be subtle. The article mentions the possibility of lesions in the vagina, either small raised bumps of lymphoid tissue called lymphofollicular lesions, or hemorrhagic lesions, indicating some bleeding. These might be found during a veterinary exam, but easily missed otherwise.
In anything else?
More significantly, perhaps, is the link to infertility. The article notes a higher seroprevalence, meaning more dogs, showing evidence of past infection in their blood in kennels that are experiencing reproductive problems.
Interesting. So it could be a factor in dogs struggling to conceive or carry litters.
It seems possible, yes. It's implicated.
And we have to come back to the eyes again. The article is quite specific here. It calls CHV a common cause of acquired idiopathic conjunctivitis.
Right, idiopathic meaning the cause isn't immediately obvious.
And ulcerative keratitis, ulcers on the cornea. That's a frequent result of those reactivated infections.
Exactly. So if you have a dog with recurring eye issues, especially corneal ulcers that keep coming back, CHV reactivation could definitely be on the list of possibilities.
Okay, let's dig a bit deeper into the virus itself. The article calls it a typical herpes virus, only one known serotype. Why is the single serotype important?
Well, theoretically, having just one serotype makes things simpler. For instance, if you were developing a vaccine, you'd only need to target that one type. Though, as we'll touch on, widespread effective vaccination isn't quite there yet. The article also really stresses that latent infection is endemic.
Endemic meaning?
Yeah.
It's just always around. Part of the background.
Pretty much, yes. Consistently present within the domestic dog population worldwide, most adult dogs have probably been exposed at some point.
And who's most vulnerable then? Thinking about causes and risk factors, we know newborns are, but what situations increase the risk?
The article is clear. Young female dogs who haven't encountered CHV before, the naive ones, and their newborns are at the greatest risk.
Because the mother has no immunity to pass on.
Exactly. No protective antibodies transferred across the placenta or in that crucial first milk, the colostrum.
Right.
And the environment plays a big role too. Closed breeding kennels are mentioned. While many adult dogs in a stable kennel might be immune, introducing a new, naive, pregnant female into that environment is high risk. She's likely to encounter the virus.
That makes total sense.
Yeah.
Stress of moving plus exposure. The article even warns about abortion storms.
Yes, that's a stark term. It describes situations where maybe several pregnant dogs, perhaps naive ones from different homes, are brought together for whelping, maybe at a boarding facility.
Right.
If the virus gets introduced or is already there, you can see massive losses, multiple abortions, or neonatal death. A very risky scenario.
And what about reactivation triggers in adults with latent infections?
The main trigger mentioned, besides general stress, is immunosuppression. So if a dog is on certain medications, like corticosteroids for allergies or autoimmune disease, that suppress the immune system.
Yeah.
That can be enough to allow the latent CHV to reactivate. Often this shows up as those transient eye problems we talked about.
Right, the conjunctivitis or keratitis.
Sure.
Okay, so how do vets actually distinguish CHV from other things, especially in sick newborns where symptoms might overlap? The article lists some differential diagnoses.
That's a key clinical challenge. When you have sick or dying puppies or reproductive failure, you have to consider other causes. The article mentions bacterial culprits like Brucella canis, coliform bacteria like E. coli or Streptococci, also toxoplasmosis, which is a parasite, and even exposure to toxins.
And how do they differ from CHV?
A key point the article makes is that These other conditions usually don't cause the specific characteristic gross lesions, the things you can see with the naked eye on postmortem that CHV does, particularly in the kidneys.
Ah, okay. What about other viruses? Mentions MVC, which is canine parvovirus type 1, and distemper and hepatitis.
Right. MVC, or canine minute virus, tends to cause more specific enteric or respiratory signs in pups, again without those classic CHV lesions. And distemper and canine adenovirus type 1, the cause of infectious canine hepatitis. They're much less common now thanks to vaccination. Plus, they also don't typically cause those very distinct kidney lesions that scream CHV.
So those kidney lesions are really a big clue. When a vet suspects CHV, what tests and findings confirm it? The article gets pretty technical here.
It does. On basic blood work, a CBC, they mention you might see a low platelet count, thrombocytopenia.
Might? Okay.
Yeah, not always definitive. A firm diagnosis usually involves finding the virus itself or its footprint. Techniques like immunofluorescence or immunoperoxidase staining can light up the viral antigen, the protein, right there in the damaged tissues.
Right.
Growing the virus in the lab, virus isolation from cell cultures, is another way. They stress using refrigerated samples, especially from lung and kidney, not frozen.
Okay, refrigerated, not frozen. Good tip.
And PCR, polymerase chain reaction, is very useful too. It detects the virus's DNA. You can run PCR on tissues from deceased pups or even on, say, conjunctival swabs from a dog with eye disease. It can also be used to screen apparently healthy dogs before breeding to see if they might be carriers.
That's helpful. And on post-mortem, what are the key things they look for, both visually and under the microscope? You mentioned the kidneys.
Yes, grossly, meaning what you see with the naked eye during a necropsy. The article describes widespread small spots of necrosis, tissue death, and hemorrhage, bleeding, in multiple organs.
Okay.
But the kidney lesions are considered pathognomonic. That's a key term.
Pathognomonic, meaning?
Meaning if you see these specific lesions, it strongly points to one particular disease. In this case, diffuse hemorrhagic areas, dead spots, and blood clots blocking vessels, hemorrhagic infarcts, all scattered throughout the kidneys. That's highly characteristic of CHV in pups.
Got it. Are other organs involved?
Yes, similar lesions, though maybe less dramatic, can be seen in the lungs, the liver, and the adrenal glands. Small intestine involvement is variable, but they often see generalized enlargement of lymph nodes in the spleen and panuveitis inflammation of the whole eye.
And microscopically, what do pathologists see?
Under the microscope, they're looking for foci or clusters of necrosis, often around small blood vessels, with generally mild infiltration of inflammatory cells. This can be seen in many organs, including the brain.
The brain, too.
Yes. And in pups that survive the initial onslaught but have neurological issues later, the article mentions specific findings like non-suppurative ganglion radius, inflammation of nerve bundles without pus, meningoencephalitis, which is inflammation of the brain and its coverings, and necrosis in the cerebellum, which controls coordination, and the retina at the back of the eye.
Wow.
They might even find specific little bodies inside the cell nuclei called acidophilic intranuclear inclusions, though these aren't always present or easy to spot. And importantly, in cases of abortion or stillbirth, they might find necrotizing lesions in the placenta.
So it paints a really grim picture, especially for the young ones. Given all this, what can actually be done? The article is quite blunt, saying treatment for the systemic infection isn't recommended and antivirals don't work. That sounds hopeless.
It is very discouraging for the systemic neonatal form, yes. Once those signs appear in a very young pup, the prognosis is extremely poor, and antiviral drugs haven't proven successful in changing that outcome.
Is there anything that helps?
Well, the article does mention one potential intervention. Using immune serum. That's basically the liquid part of blood containing antibodies taken from female dogs who have recovered from CHV.
Okay.
If this serum is given to at-risk puppies before they get sick, essentially providing passive immunity, it might help reduce mortality. But timing is critical. It has to be preventative.
Before illness starts.
Right.
What about the eye disease in adults, the reactivated form?
For the ocular disease, the article suggests that topical Cidofovir, which is an antiviral eye drop, may be effective.
Maybe?
Yeah, they include that caveat because it's based more on anecdotal reports or small case series. There haven't been large controlled clinical trials to really confirm its effectiveness and optimal use, so it's an option vets might try, but not a guaranteed cure.
Understood. The article also touches on medications again, just reminding us that immunosuppressants in adults can trigger reactivation in eye issues.
Right, that's an important consideration if a dog needs those kinds of drugs for other health problems.
But it also offers some hope, saying that bitches who have had CHV losses can go on to have normal litters later.
That's a really crucial point for breeders. It's not necessarily a permanent infertility issue. Once the female develops immunity, future pregnancies are often successful.
Is there a vaccine?
The article mentions an inactivated subunit vaccine that is available for pregnant bitches in Europe. However, it also notes that the actual benefits or level of protection it provides are still not fully clear or perhaps widely proven.
So not a silver bullet yet. What about prevention through management, especially in kennels?
Yes, some practical advice there. Isolating pregnant dams is key, particularly young ones or any new females being introduced into a kennel environment. Keep them separate from the main population, especially in the last few weeks of pregnancy and the first few weeks after whelping.
Why is introduction such a risk?
Because, as the article notes, latently infected adult dogs can start shedding the virus again, often through nasal secretions, for maybe a week or two just from the stress or excitement of encountering new dogs, even if they seem perfectly healthy.
Ah, okay. So isolation minimizes that exposure risk for the vulnerable pregnant female.
Exactly. And finally, there's that sobering reminder. Even if puppies survive an early CHV infection, they're not necessarily out of the woods. They can suffer from long-term damage, deafness, blindness, brain damage, encephalopathy, or chronic kidney problems.
Right. So let's try to wrap this up, our deep dive into canine herpes virus. It's clear, well, it's everywhere, isn't it?
It's certainly widespread, yeah.
And it poses a very serious threat, especially to the youngest puppies and unborn litters. Often hides silently in adult dogs, which makes it tricky.
The silent carrier aspect is key.
And when it does cause obvious illness, particularly in newborns, the outcome is often, frankly, tragic. Diagnosis isn't always simple, relies on specific lab tests and finding those characteristic lesions, especially in the kidneys.
Absolutely. Awareness is just critical for breeders, for vets, for anyone caring for pregnant dogs or young pups. Understanding the risks, the potential signs, how it spreads, that's the first most vital step in trying to manage it.
Definitely. And maybe here's a final thought for everyone listening. Given how common these latent CHV infections are, and knowing the virus can reactivate potentially throughout a dog's life, what are the bigger long-term effects on the dog population as a whole? We talk about stress and immunosuppression as triggers, but could other environmental factors, things we don't even recognize yet, be playing a role in when and how this virus wakes up and spreads?
That's a really interesting question. There's likely still a lot we don't understand about the complex interplay between the virus, the host's immune system, and the environment over a dog's lifetime. Definitely food for thought.
Indeed. Well, thanks for joining us for this deep dive today.